the data on how much we like our health insurance.
Marketplace Morning Report is supported by Bitwarden Password Manager. From crowded stores to cybercrime, this season can cause anxiety. Bitwarden can offer peace of mind with secure autofill for credit cards. Available at bitwarden.com.
I'm David Brancaccio in New York. We're leading with what the data show about America's attitudes toward health insurance companies. This at a time that social media has been ablaze with criticism of a system that's often confusing and frustrating for patients. And in the wake of the murder of his colleague earlier this month, the CEO of the parent company of United Healthcare has acknowledged that the healthcare system needs fixing. A survey from last year found that most people give okay marks to health insurers, although the grades go down for people who need care more. We also know that about 15% of insurance claims are denied, according to the National Association of Insurance Commissioners. Kay Pastena is vice president at the nonprofit KFF, which has done research on this. Welcome.
Thanks for having me.
Your team did scientific polling on this, and most insured adults give health insurance companies positive ratings. How positive?
Most folks like their insurance. They're happy to have it. The issue is what happens when they have to use it. When you drill down, about 60% of those we surveyed indicated that they had a problem with their health insurance. Most people don't need acute health care most of the time, which is a good thing, particularly those under 65, right? Those with employer coverage. We always talk about maybe it's about 20% of folks who are really spending most money because they're the ones who are in need of health care. And so I guess it's not a surprise that most people are okay with their coverage because most people aren't using it. But for those who do and have to use it a lot, that's where our focus is.
And so that I'm fully clear, your team found that people in worse health, and I assume needing more health care, have more problems with their insurance when you asked.
Yes. I mean, I think that's the experience of people. For someone who's having maybe a car accident or a cancer diagnosis or diabetes or mental health, these are episodes of treatment where there's a lot incoming, lots of bills and insurance information that's all coming at once at a time when you're most vulnerable. And you can imagine the frustration.
Now, when you step back slightly from this, you're reminded of just the confounding nature of America's healthcare system, where it's not that someone has just walked into a mall and decided that they wanted to buy that pair of pants. It's that a professional, a healthcare provider, has said, you probably need something. And then the health insurance company says, yeah, but we're not going to pay for it. Just that contradiction.
It's a complicated process, and not every claim denial is inappropriate. I mean, some care shouldn't be covered. But in addition to our consumer survey, part of our research is trying to figure out what is this claims review process? How is it working? Who's doing the review? How is it being reviewed? How many denials are there? What claims are being denied for what type of care? What are the reasons? And also just how fast are those decisions being made? Getting more information about what's happening in the claims review process on the ground.
You'd like the providers to tell the patients in advance, but of course they, in a sense, can't fully because they don't know exactly what your insurance company is going to do.
There are definitely some federal reforms and many at the state level that were designed to get folks more information. Some are just not yet implemented. Some consumers are not even aware of. We asked consumers about, when it comes to claims, did you know that you can appeal a denial of a claim? Just about every consumer can. It doesn't matter what kind of coverage they have. And many just weren't aware there was a process in place to do that. We don't have transparency. There are some transparency protections as well under federal law, transparency and coverage. They were part of the Affordable Care Act that mostly haven't been implemented. We don't have a lot of information about the types of care that was denied and why. And, more information there as an oversight item is probably useful.
Kay Pastena is vice president at KFF, a nonprofit health policy research, polling, and news organization. Thank you very much.
Thank you.
U.S. consumers keep at it with news today that retail sales rose more than expected in November, up 0.7%. Could this strength keep interest rates higher for longer? The Federal Reserve starts meeting on growth, jobs, and inflation today with an interest rate decision tomorrow. S&P futures are down 0.4%. NASDAQ futures are down 0.3%.
Marketplace Morning Report is supported by Schwab. With Schwab investing themes, people can invest in ideas they believe in, like artificial intelligence, renewable energy, pet passion, and more. Over 40 themes to choose from. More at schwab.com. And by JTV. Jewelry Television's color gemstone jewelry includes more than 70 different gemstones. Find JTV on your TV or at jtv.com.
This week, the Senate is expected to take up what's called the Social Security Fairness Act. It would help government workers who receive pensions outside of Social Security. But this costs money and would add to the budget deficit. Marketplace's Nancy Marshall-Genzer explains.
The Social Security Fairness Act already passed the House last month. It would get rid of Social Security's government pension offset and windfall elimination provision. They reduce benefits for people who get pensions from jobs not covered by Social Security who didn't pay into it. Henrietta Treyz is co-founder of Veda Partners. She says eliminating those two provisions
allows for Social Security payouts to a lot of civil servants, including firefighters, nurses, postal workers, folks in unions, folks not in unions, and increases the amount of Social Security payouts that they would get.
Supporters of the bill say it's a matter of fairness because some of those workers had other jobs where they did pay into Social Security. But opponents say the legislation would give these workers an unfair advantage and overgenerous benefits. Treyz says the bill's price tag is also an issue.
It does increase the deficit. It is a spending bill that is not offset by spending cuts elsewhere. There are no tax hikes on other folks that would offset the nearly $200 billion cost of this bill.
And Treyz says the legislation would strain Social Security's trust funds, causing them to become insolvent sooner and unable to cover the total cost of benefits. I'm Nancy Marshall-Genzer for Marketplace.
And here's a number +1. A survey by Challenger Gray and Christmas finds that less than 1/3 of firms are inviting significant others to holiday parties to save money or to get people on staff focused on each other at a time working from home tends to keep them apart. Our producers are James Graham, Rebecca Smiley, Elizabeth Hodson, Nick Perez, Ariana Rosas, Alex Schroeder, and Erica Soderstrom. Our senior producer is Meredith Gerritsen-Morby. In New York, I'm David Brancaccio. It's the Marketplace Morning Report. From APM, American Public Media.